Good morning. Good morning. It is bright and early on a Saturday morning. Welcome, welcome. Let's give my live stream a second to catch up with me. Today is June the 5th. Cannot believe it. I hope you guys had a wonderful Memorial Day. I took the day off last week because I had a duplex that we needed to get up and running and going. I am super excited to be here. I am all alone at home today. It is quite a change in my life. I'm sure some of you guys have been through this. I just turned into an empty nester. So yeah, it's quite exciting. There are 4 ways that you guys can connect with me. I'm going to throw them in the comments over here. My name is Lizette. I am an occupational therapist by background and training, and I am super excited to be here this morning. I would love to see your comments. I would love to see who's out there, and if there's anything that I can answer questions for you today, that's why I'm here. And let's see, I'll do my quick little introduction and then I'll get started with this program if I can find my eyeglasses. So yeah, I've had a super exciting week. My youngest daughter just graduated as a nurse and she moved to Tulsa. So for the first time in my life, I have an empty nest, and I am so conflicted about it. So here is the introduction. Welcome to the Baffled Brain, Demystifying Dementia. Since we know that dementia is complex and we know that managing challenging behaviors is time consuming and finding reliable information quickly can be difficult, we do this hour-long Facebook Live to bring you accessible place to ask your dementia-related questions, because providing caregivers like you a reliable, actionable strategies and reliable information gives the people that we care for with dementia their best quality of life. It delays their decline and decreases caregiver burnout. So welcome to the Baffled Brain, Demystifying Dementia. My name is Lizette Klute. I'm an occupational therapist by background and training, and I am here to serve you this morning. So I would love to know if you're on live, if you have any questions, please throw some questions out at me. This is why I do this every Saturday morning. I wasn't here last Saturday because it was Memorial Day and we were getting ready to do some renovation, get our duplex done. So if you're live, comment live. If you're watching replay, please comment replay. And so one of the questions that Russ had asked a few weeks ago, and he has asked this question again, he wanted to know if dementia can cause anxiety. And I thought that was a really good question, and I don't actually know whether or not it can cause anxiety per se, like an anxiety disorder. But I do think that dementia can cause anxiety. And the reason I think that dementia causes people to be anxious is because as your world is starting to change and you have all of these changes in your thinking, you know, the first stuff that happens is what's called the first thing most people start to notice is a change in their ability to remember things, right? But after that, as people start to change with their dementia-related changes, they start to lose their what we call executive functions, right? Executive functions are the higher level self-care, the higher level cognitive abilities that include things like working memory, anticipating consequences, all of these different type of higher level skills. There are about 7 of them. Time management, the ability to manage time well, planning and organizing, etc., etc. So as a person's ability to manage these things start to decrease, it seems to me to make sense that people can become anxious because of that, because of the normal changes in your brain. As your brain is starting to lose these abilities, it must be extremely, it must be scary. It must be very scary. Think about it yourself. If you know, most people who are starting, well, not everybody knows, but some people, when they're starting through this dementia process, know that they are having changes, and that must cultivate a lot of anxiety and fear and all of these difficult feelings. So yes, Russ, I would say dementia can cause anxiety. I don't know if that's a really good answer to your question, but I do think that that is definitely something that can occur. Good morning, Chris. Do you have any particular questions for me? I'm having a hard time getting my groove on this morning. I'm home alone for the first time in almost 30 years, 28 years. My husband and I have been married for 28 years, and my husband took my daughter to Tulsa, and I am alone. So, all right, here is another question on my handy dandy sheet. Transition timing, a new territory. My loved one is my mom. She stopped walking. She barely straightens her legs when lying down, and she always bends them, thinking that she has tight hamstrings, possibly getting atrophied. So mom doesn't stand well at all. When, or what other signs, or how do I decide, excuse me, if it's time to stop lifting mom and getting her out from the bed to the wheelchair to the toilet to the chair to the sofa, etc. I'm going to sneeze. And again, excuse me, to keep her in a pull-up at all times and on the sofa, and then only on the bed at night, or rearrange and just leave her in bed 24 hours a day, 7 days a week, rolling her, etc., for changing and bed issues. I thought that was a great question. So just to recap, her mom has stopped walking. She's barely straightening her legs when laying down, always keeping them bent. She doesn't stand well. What other signs, or how do I decide if it's time to stop moving mom, lifting her to the bed, to the chair, etc., and keeping her in a pull-up? So to this person, I would love to, thank you, Chris, I appreciate that. To this person, I would like to say, so as a person is starting to move through their dementia journey, we talk about this a lot, right? I talk about this almost every week. I use the functional assessment staging tool for most of my staging of people with dementia. And the reason I like the functional assessment staging tool is because it is a model of retrogenesis. Well, what does retrogenesis mean? Retrogenesis means literally back to the beginning. So as a person is progressing through the stages of dementia, they, especially Alzheimer's dementia, they definitely go through a very particular type of change, right? So we all develop, most of us develop in certain normal developmental phases, right? We're born, what's the first thing we do is we can suck and swallow, we cry, we cannot hold up our heads against gravity, we're held in our parents' arms, but we can then learn to hold the bottle, we see things right in front of us, we smile, we start cooing, gaga goo goo, mama dada, those kinds of things. We start to hold ourselves up against gravity, we sit, we bang on the table, we push things off the table, we start to feed ourselves, but we don't use a knife and fork, we use our fingers, right? We start to crawl, we start to, pull up to stand, we start to walk, we overcome gravity, right? And those are normal phases of development. So this person's questions where she said, my mom is starting to have trouble straightening her legs, she keeps them bent, she doesn't stand well. Well, this person is starting to get to a phase in their dementia where they're having difficulty overcoming gravity. And that is a normal part of dementia. It's not normal, obviously, but it is a normal progression if you use the functional assessment staging tool. People will get to a phase in their dementia journey where they are unable to maintain themselves up against gravity. So when that happens, there are a few things that you have to start to think about. You have to start to think about how safe is it for you to bring them up against gravity, because if they're a larger person, you could get hurt, right? And you want to make sure that you keep your loved one safe. Obviously, this person mentions that her mom always keeps her legs bent. So what do you do when people are in these later phases of dementia? You do range of motion with them. You have to try to stretch out their legs, stretch out their arms. You can do it when you're doing bathing. You can do it when you're dressing them. Rub lotion on their arms. Try to be close to them, speak to them. People can still hear. They definitely can still hear us. They can still feel. They can still smell. So you want to do range of motion so they don't get tight. So she said, what other signs does she need to do to say whether or not she needs to still transfer her from the bed to the chair, etc. So if you can sit somebody up on the edge of the bed and they can hold themselves upright against gravity, once you get them positioned, set them up on the edge of the bed. If they can hold themselves up against gravity and if they can bear weight on their legs, then it is still appropriate to transfer them. But you have to weigh your pros and cons. Without knowing more about the size of the person, etc., it becomes very difficult for me to give a very specific recommendation. But there are some strategies you can use. Some things that we don't think about a lot are lifts, right? I think it's healthy for people. I know it's healthy for people to get up out of bed. There are so many things that happen when people stay in bed. They're more at risk for pneumonia, they're more at risk for contractures, they're more at risk for bed sores, they're more at risk for all of these sorts of changes in their body. And think about yourself, right? If you do not get up out of bed, do you wake up? I don't. Good morning, Melissa. Good morning, Jackie. Jackie, you're correct. I'm looking for some questions from you guys. Otherwise, I'll just use my handy-dandy cheat sheet. But being up out of bed is extremely, extremely important. So to this person who said, how do I make this decision as to when it's still appropriate to get my mom up out of bed? As long as she is able to maintain herself upright against gravity, and as long as you feel comfortable and confident in transferring her, I would recommend getting her up out of bed. But there are some things that you need to think about. You can look at some lifts, right? There are Hoyer lifts. My favorite is actually not a Hoyer lift. It's called a stand lift. And unfortunately, here in the United States, it's an upgrade for Medicare. But if you get a stand lift, that is a way that you can transfer somebody using a stand lift to and from the bed. They have a strap around the person's waist, and there's a block by their knee, and then there's a hydraulic lift that actually stands them up. The reason I like these stand lifts, even though Medicare doesn't pay for them and they are an upgrade, you can actually put somebody on the toilet using them, because the lift stands them and then you can pull their pants up and down, and you can use the lift to hold them up while you're wiping them. So I would recommend, if you have questions, please throw them out in the comments. In the comments, I put out ways that you can reach me. You can join my Facebook group called Think Different Dementia. You can set up a phone call with me on my Calendly link if you have specific questions, or if you have specific things that are not appropriate to ask in this forum. You can email me at thinkdifferentdementia@gmail.com. You can join my You can just subscribe to this my channel on YouTube called Think Different Dementia. So please reach out. I'm waiting for somebody to throw me out a question. Nobody's giving me any questions this morning. I need some questions, guys. So here's the next question. This one was from Allie. Allie said, we really cannot do this anymore. How do you not feel guilty putting them in a home? We found a place that seems amazing. It is within walking distance of us, and the people there seem happy. They do a lot with them. The town does a lot of things for the residents here, but we are also worried. So, Miss Allie, I absolutely understand that that is a very difficult decision to make. What I want you to understand is it is entirely your own decision. There is no right or wrong. Nobody has the right. Nobody has the right to tell you it's wrong to put somebody in a skilled nursing facility or a nursing home or an assisted living or a memory care unit. It is your decision. There are so many factors that play into when or when not to put somebody into a facility. There are good facilities. COVID has been very difficult because of how it's changed the access to people in a facility. But before COVID, and I know things are changing back again, before COVID, the best way to manage having somebody in a facility is to do your research well, to still be the person who you are taking care of, be their advocate. Not everybody can take care of somebody at home. Not everybody can provide 24 hours supervision for people at home. There are legitimate reasons why people need to be in a facility. Some reasons for that are they need two-person assistance. They have very, very difficult behaviors that are very difficult to manage 24 hours a day, 7 days a week, one person or two people at a time. So there are legitimate reasons. What are some other things that you need to do? You need to go visit the facility at various different times of day, not just between 8 and 5 when everybody is there. Never have a routine. Always be, it's okay to have a routine, but then be unstructured in your routine as well. And what I mean by that is don't always say, I'm coming between 7 and 10 o'clock in the morning, because then guess what? Your loved one is always ready between 7 and 10 o'clock in the morning. You want to consider coming at different times of the day. You want to make sure that you are not predictable. Get to know the staff, get to know the other residents, be active in the facility, and that is how you ensure that your loved one, Miss Allie, gets the best care that they can. There are some very good reasons for facilities. Activities is one of them. You mentioned that in your question. And if the residents seem happy, that is definitely a good sign. You can ask for some testimonials. You can ask for people to ask for the facility to give you names of references of people who have either passed away or who are still there, so that you can ask them their experiences. So these are some things that you can do if you were considering putting your loved one in a skilled nursing facility. You didn't specify, or a memory care unit. There are definitely legitimate reasons why people need to be in a facility. And if you really honestly cannot feel like you can do this anymore, then it is time to seek alternatives. And do not feel guilty. Guilt is a legal term, right? You're not doing something wrong. You're not doing something wrong by placing somebody in a facility if you cannot take care of them anymore. So Miss Jackie says, my mom scratches her legs every night. You get them healed up and then she scratches them bloody. I've put plenty of cream on them. Any advice? So have you looked at skin, oh gosh, what are they called? Protectors. They make them for arms. So I'm fairly sure that they must make them for legs. Let me think. Let me see if I can, where's my phone? if I can Google it on my phone and come up with the right word for it. There's sleeves. There's arm protectors or one. They are, there's some sleeves that are made for people's body parts, mostly the arms, but I'm pretty sure that you could find them for legs too. And in nursing homes, we put them on people's. They almost look like, think old timey gloves, right? Excepting they don't have fingers. And so they make them for arms and legs, and you can go look up on Amazon. They're called arm protectors or leg protectors on Amazon, okay? And try putting those on underneath her clothes, because then she has an extra layer between her and her skin and her, maybe that'll protect her from scratching herself. And so I am typing, and I cannot type and talk at the same time. Apparently, you can only walk and chew gum once. So there is a link for arm protectors, and let's see. Let's see if there's leg protectors. Here's some leg protectors for thin skin. And so you could try that. That definitely might make a difference, trying to keep her from accessing her skin. The other thing you can try is maybe trying putting on some gloves, right? So if the leg and arm protectors don't work, then try to put gloves on her so that she doesn't actually break open her skin. So Miss Jackie, I hope that was helpful. I'm looking for some more questions here. I did something similar. You will look at my suggestion. Great. Try gloves. Keep her fingernails short. Try gloves. Try the leg protectors. Bottom line is sometimes you try something once and it doesn't work, then you come back and you try it again and it does. So you just have to keep trying different things. If she's wearing short pajamas or tops, maybe try long pajama legs. You can try pajama pants that maybe put a elastic band in the bottom of the pajama pants so she cannot just pull them up. Lots of different strategies. I would start with that, especially if you can heal them up. If we can keep her access away, that will definitely help decrease her opening up her skin. So anybody else have any other questions while you're watching? If you're watching live, she just rips them off. Yes, so try different things. Try lots of different things. They do also make a it's kind of like a restraint. If you're in a nursing home, it would be a restraint, and let's see, like a mitt where you can, let's see, it's not what that wasn't what I was looking for. And mitt to keep people from being able to get their fingers out. So, I'm throwing lots of different ideas at you here, Miss Jackie. So there you go. Here's another thing that you can try. It's a mitt that you put on, and so in a facility, sometimes they will put people's hands in mitts so they cannot scratch themselves. So Miss Heidi said, I just have to say today that I'm losing my mind, and I can totally understand that. And my nose is running. Excuse me. I sneezed earlier, now my nose is running. Ms. Heidi said, I just have to say that today I'm losing my mind. I've been taking care of my mother by myself for probably going on 15 years. Today she has asked me the same question every 30 seconds all day long, and I'm about ready to lose my mind. I'm stuck in this house with her all day, and I'm trying to keep my full-time job, and I'm really feel like I'm losing my mind. I know you all feel the same way, and I just needed to vent. Thank you for listening. And so, Ms. Heidi, I understand how that must feel. It is very challenging. Hey, Lori. It's very, very challenging when somebody is asking repetitive questioning. And that is something that we call a challenging behavior. Melissa was on earlier. I don't know if she's still on. Both Melissa and I are Skills to Care certified. It is a very specific certification for occupational therapists to work with people and caregivers of people with dementia on challenging behaviors. And so what we always want to look at when we are having these challenging behaviors, and I was thinking about this earlier. What are challenging behaviors? Well, challenging behaviors are anything that kind of pushes anybody's buttons. It can literally be anything. It is wandering, it is sundowning, it is anxiety, it is anger, it is repetitive questioning, it is difficulty transferring, it is incontinence management, it is any and everything that people with dementia struggle with when we have to help take care of it, right? And so when Heidi speaks about her mom is asking repetitive questioning, where my mind goes to first, Heidi, are a few things. Number one, is a time you mentioned working full time. Do you have respite care set up for yourself, right? And so when I work with my patients and my family members, I always look at it in this manner. We have a person with dementia, and we have a care provider, because a person with dementia frequently cannot live by themselves, right? Or eventually will get to the point where they cannot live by themselves. But care providing can come in a variety of different ways. But a lot of times care providers are still working. And so we have a person with dementia, we have a care provider. And what happens is people who are caring for other people with dementia will flip-flop the what I call the hierarchy of caregiving needs. So think about being on an airplane, right? When the air hostess or the flight attendant, or whatever the word is these days, goes up front there and teaches you, if the plane goes down, what's the first thing, if you're flying with somebody who needs help, what's the first thing that you have to do? You put the oxygen on yourself, right? You do not put the oxygen mask on the child or the person that you're flying with who needs assistance. Why? Because if you don't take care of yourself first, they're gone, because you have to be able to take care of them. So a care provider, Miss Heidi, has to be able to take care of themselves first. And what that means is you have to build in respite care. So take care of yourself first. Actually, the way I say it is the household first, then you, because if you think of Maslow's hierarchy of needs, right? Food, shelter, clothing first. So the household has to function first, and then you, and then your mom. And so Heidi, I know that when somebody is saying the same thing over and over and over again, it is extremely frustrating. So have you built in respite? If you're trying to work it full time and your mom is needing more help, what are some things that you can do? Have you considered an adult daycare? Have you considered looking at getting some caregivers coming in and giving you some respite care so that you can easily feel like you can go and walk away and still provide your mom with the care that she needs? Now, as to the repetitive questioning, so that is a totally different question. That is a very there are lots of reasons. What are some reasons people do repetitive questioning? Are they bored? Are they feeling overwhelmed? What's going on in the household? So Melissa and I would usually say you need to start a dementia diary. You need to write down what's happening right before these repetitive questioning. Is she anxious? There's so many different things that could be triggering that behavior, but without knowing what's going on in the household, it makes it very difficult. There's 3 to 4 things. There are actually 4 things that you want to look at. You want to look at the task. You know, what's going on, the task involved. You want to look at the environment, right? What's going on in the environment? Is she bored? Is she overstimulated? Is she understimulated? Is there a lot of people there? Or is this behavior happening only when certain people are there? Is it a specific time of day? Is she sensing, you know, what's going on with her? Was this a change in her behavior? Was this she's doing it every day at the same time? What are the triggers? So we look at the caregiver. Is she sensing your anxiety because you are trying to do too much, because you're working full time, and you know, this behavior of the repetitive questioning is making you, and she's sensing that, and you guys are feeding on one another. So there's so much. So start a dementia diary. Miss Heidi, and I know that Melissa actually sells one on Amazon. So Melissa, if you're still on, please go ahead and put it in the comments. Dementia diaries are extremely, extremely handy, because you want to diarize when things are going well, and you also want to diarize when things are not going well, right? You want to make sure that you are looking at all of the different factors of what may or may not be triggering these challenging behaviors. And the challenging behavior that we were just talking about is repetitive questioning. So anybody else have a question? Miss Lori, do you have a question for me? And Jackie, yes, it is very, very hard when your loved one repeats themselves. And I'm an occupational therapist. I tell you guys this frequently, right? I'm an occupational therapist by background and training. And I'm also the daughter of dementia, right? I am the sandwich, the filling between parents who are starting to need me. My parents are in their early 70s, and my kids who have just moved out of the house, right? So I'm that sandwich. My mom had a stroke in her early 40s at 42, and she is now 73, and so she has definitely had some changes over the past several years. Not a formal diagnosis. I don't need a formal diagnosis to know that she has vascular dementia. It's very evident to me. And so I am kind of walking with my dad, who is walking with my mom, right? And now I'm seeing changes in my dad. And so it is very challenging, right? It's challenging when we're working with and walking with our loved ones with dementia. But I'm here for you. Okay, Miss Shabby, welcome. That's an interesting name. I'm finding it hard to find a good home health care agency. Where do you start? Home health care agency. Okay, let's talk about home health care agencies. There are 2 types of home health care agencies. One is a medical home health care agency, SHIBI. I'm sorry if I'm butchering your name, but there are 2 types of home health care agencies. A medical home healthcare agency, which is nursing, social work, physical therapy, occupational therapy, speech therapy, home health aid. That's a medical home health care agency. They are typically short-term, at least here in the United States. I'm not sure where you live. They're short-term. They come in, they have to work on things that are skilled, and then they transition out. You can research a medical home health, a medical home health care agency on CMS.gov. So CMS.gov is Medicare's website, and you can look at Nursing Home Compare, or just go to try to find the part on the website where you can compare different agencies. You put in nursing home compare. You can put in your zip code and it'll pull up all of the agencies. You can do this for nursing homes. You can do this for medical home healthcare agencies, not a non-medical home healthcare agency. A non-medical home healthcare agency is usually, and at least I can only speak to South Carolina, licensed in the state where you are located. So a best way to look at those is probably through your Better Business Bureau. You need to find people who have reviewed. I would look at Yelp, funny enough. I would look at all of these different places where where people are reviewing agencies. But the Better Business Bureau for a non-medical home healthcare agency might be a place that you could take a look at, Shibi. And I am very, very, very sorry if I've butchered your name. But welcome. I hope that was helpful. If you're still out there, throw me a comment that said that it was helpful or not helpful, and I will try to answer it more fully. Miss Lori, yes, I love your questions. You're only able to bend your husband's legs and right arm as he sits in the wheelchair. His left arm is atrophied from osteoarthritis. Should you try to move his left arm? Absolutely, as long as it's not contracted. So what is the difference between a contracture and between atrophy, right? Atrophy, if you think about atrophy, so what does atrophy mean? Atrophy means the muscles are wasting away. Okay, so wasting away. So when you look at somebody's hand and they have certain nerve damage, you'll see the wasting away of their muscles in their hand and in their arm from nerve damage. Now, atrophy can also be from a stroke because the muscles aren't getting the messages anymore. Typically, osteoarthritis doesn't cause atrophy. Osteoarthritis is arthritis, right? It makes the joints swell up and so on. So what I would guess is that your husband might, what I would be trying to determine, Lori, is it truly atrophy or is it a contracture, right? A contracture, what is a contracture? A contracture is when the muscles shorten and then you cannot straighten or bend the arm. And it's usually in people with dementia, they'll go into a flexed, bent posture. Think fetus position, right? They'll go into a flexed posture. And so these, specifically here at the wrist and at the fingers, will get shortened, right? And so if you try to straighten it and you feel resistance, Miss Lori, it might actually be a contracture and not atrophy. If you can straighten it and bend it all the way, he has an infected sore on his elbow and his arm was hurting. So is he receiving any therapy for that to make sure that he's not getting, number one, are they looking at the sore on his elbow? To me that says, Lori, that when he's laying on his thigh, or when he's laying in the bed, they're not doing a good job of positioning him and he's getting skin breakdown, right? That was one of the things that we started to talk about at the beginning of the program. I would be asking for occupational therapy in the nursing home to look at bed positioning and positioning in a chair to make sure that he does not get any wounds. It is a skilled service for people in a nursing home to use their Medicare benefits, Lori, in order for them to be able to prevent bed sores and contractures. So squeaky wheel gets the oil. There are types of splints that they can give people. I don't know how contracted he is, but I would definitely be trying to range it out. And I would be squeaking and asking for some occupational therapy in the nursing home for bed positioning, and if they give you any kind of fleck, you say to them, I know, and his hand is like a claw now. Okay, what are they doing to keep it open? So let's talk about that a little bit, right? So people who have had strokes or so on will get contractures over time in their heads. So what I would want to know is, can you still open his hand enough, and does he have a sore on the inside of his fingers, right? Can you open it enough to get something in there, like a palm protector? I've been doing Amazon a lot this morning. Palm protectors, they're something that you can slide in between the skin to keep the skin from getting skin breakdown on the inside of the hand. Okay, so Lori, I would ask for occupational therapy. I want to know what's going on the inside of that hand. It's the technical term. My technical term is called stinky hand syndrome. We don't want him to get stinky hand syndrome, and we definitely don't want him to get a sore on the inside. But yes, you need to move his fingers. You need to move his elbow. You need to try to get the therapy department to do their job and pick him up for therapy, just for some positioning, okay? So that's where I would start. Anybody have any other questions, Miss Lori? Do you have another question for me? All right, so Miss Erica said, I am the sole provider for my grandmother. She is in the final stages of Alzheimer's, and she was just put on hospice within the last month. She says that she's her transportation everywhere, getting in and out of bed, going to the bathroom. She lifts her, etc. The ups and downs in lifting is taking a toll on her back, absolutely. She's 42 and in pretty good shape. And her grandmother used to be heavy, but now she's only 120 pounds. But when a patient does not want to move and they're complete dead weight or combative, it makes it 100 times harder. A Hoyer lift is not very functional in her home, so she's kind of stuck on options. So Ms. Erica, first of all, I would like to say I'm so sorry that you've had to do hospice now with your grandmother. I know that must be extremely difficult. I applaud you for putting her on hospice, because we wait too long with our loved ones with dementia to get them on hospice. We need to definitely consider hospice a lot sooner on in a person's journey, because hospice has a lot that they can help you with. They can give you more aid, assistance, a nurse. There's a lot of equipment things that hospice can help with. So I definitely think that is a very important thing, but I know it's hard to make the decision to put somebody on hospice. So I'm sorry your grandmother's on hospice. As to what kind of things that you can do for transfers with people with dementia, and I agree, a Hoyer lift is not necessarily always a very functional thing, but they do play a role. If you have carpet on the floor, if you can put a hard piece of wood over the carpet on the floor, it makes using a lift a little bit easier in a person's house. It's very difficult to use a Hoyer lift on carpeting. It is terribly hard. But if you can put something hard on the floor to help with the lift, that may make a difference. They also make, depending on a person's financial resources, everybody has different financial resources. They make things like a stand lift, right? And you can buy them on Amazon. They make them in a variety of different sizes. And like anything, right, we have the Cadillac version and we have the Volkswagen version. So you can buy a stand lift, a hydraulic stand lift, all the way from $600 to $3,000 and anything in between. Stand lifts play a significant role, can really, really, really make a person's life in caregiving people helping people with dementia can make a tremendous difference. And that's one of the difference between a person being in a skilled nursing facility and at home, right? Is in a facility, we have equipment. And so when you have equipment, when you have the right equipment, it is very easy to manage people better. But when a person is resisting, so you talked about your grandmother not wanting to move and being complete dead weight, and she's on hospice. A couple of things, Erica, that come to my mind is, number one, she's afraid. Is she getting to the point where she's having trouble maintaining herself against gravity, and so she's fearful, so she's resisting? And so, when people get to that point, we have to start to weigh the pros and the cons. We kind of talked about this at the beginning of the program. The pros and the cons of getting somebody up and moving them when they are starting to be resistant to the care in that regard, because yes, it is healthy to get a person up, but if you have the ability to then, if she's afraid and that's why she's resisting your transfers, a Hoyer lift or a stand lift or something like that might be a better idea. You can ask, even though somebody has, and this is a little known rule, just because Chevy, there you go, Chevy, there we go. So you can ask for a physical therapy or an occupational therapy consult, even though somebody is on hospice. When somebody's on hospice, they will let that you have to fight for it, but it is paid for. Medicare will pay for it. The hospice, the way hospice in the States is paid is like a bucket, and so everything comes out of that bucket. But therapy is not contraindicated even though somebody is on hospice, okay? They won't be there for long. It won't be to improve things. But you can ask, I want a therapist, a physical therapist or an occupational therapist to come in and teach me how to transfer my grandmother the best way, and they are legally obliged to provide that. They have to get a doctor's order, but they are legally required to provide that. Miss Charlotte, thank you so much for the compliment. I am sorry that I didn't get back with you. It was a tremendously crazy week in my life. On Thursday, my daughter and my husband left. I have an empty nest. I have a goal for myself today. I'm actually going to get into my house that has fallen apart around me for the last several months. You can't see. I look like I'm a hoarder right now, but anyhow, I'm actually going to clean my house and sort and try to get rid of some stuff. So thank you for that compliment, and thank you so much for the card you sent me. It was super, super sweet, and I truly appreciated it. All right, so anybody else have any questions for me while I am waiting on a question? There are 3 primary ways to get a hold of me. You can join my Facebook group called Think Different Dementia. You can message me, Lizette Kluta OT. Ask Charlotte. I do get back to people, and I answer people's questions when they message me. You can subscribe to my YouTube channel at Think Different Dementia, where these videos are posted later on. I do a second one of these a week in my private group, where I do a little bit more topical things. You can email me. You can call me on the phone. I'm here to serve you. So Lucy said, and this was last week, I try to write down some questions that people have during the week. Lucy said, I am the caregiver of an amazingly sweet woman dealing with dementia. She used to see her twice a week, and she had to stop for 4 months to take care of her other client who passed away a couple of weeks ago. Now she's back with her dementia patient, and she sees how deteriorated she has become. She cannot recognize her home, her family, and is extremely confused. Her conversations don't make any more sense. She used to paint, crochet, do handcrafts, but now she does not know how to help keep her mind and her hands busy. We still do laundry, folding towels, napkins, halfway helps, but what else can we do? How can I help her deal with her feelings of being lost? I absolutely love her endless smile. Oh, that is so sweet. And my heart aches to see it in her eyes that she is feeling lost. Can anybody please send suggestions? So, Miss Lucy, yes. What are meaningful activities? Meaningful activities are anything that we can engage somebody in to engage them in their environment, right? And so when a person is getting to the point where they're at that phase, maybe you can, repetitive things. So it sounds like, based on your description, like the person you're caring for literally needs step by step. So you want to pick things that have one-step activities: folding towels, sorting 2 items, not 3. Give them. You just request, Charlotte. I will. I'll get back. I'll loop back to that. You give them one. I totally derailed my brain. You give them one-step activities. So folding towels, sorting between 2 things. They can be colors, or sorting. Folding, giving her socks to roll, or you can. I find at these later stages, you can give people something like a ball of yarn and have her wind the yarn. You can try to give her something to throw, something that's a one-step. If you want to do some meaningful activities like cooking, just because a person cannot do the entire task of cooking doesn't mean like you want to make some scrambled eggs or something like that. Take her to the kitchen, have her break the egg. Don't care about the egg, looking terrible when it gets in, or there being shell. You can dig that stuff out, right? You can break the eggs and give her a whisk and have her just whisk it up. So you want to make sure that you are giving her something that is just one step at a time. You may literally have to sit there and if you want to do something that's 3 steps, tell her step by step, okay, this is what we do next. You can give her things like, we did this in South Africa all the time, balloons filled with paint on a paper on the floor where you just throw them. We got very creative and put thumbtacks through them so that you could, make a cause and effect type of things. So things that are very, not necessarily putting things together, but taking things apart. Charlotte, how do you get into the other group? It is just thinkdifferentdementia@gmail.com. I'm sorry. What the heck did I just say? Let me pull it up. I'll put it in the comments. You just request to join the group. And so Think Different Dementia is the group's name, and I do a second activity every. The last 2 weeks it's been on a Thursday. It's usually on a Tuesday night, and what I'm trying to do in this other group is topical stuff. So a few of the topics that we've covered over the past few weeks are urinary tract infections, because I thought I had one and I didn't. This past week, what did we talk about this past week? We actually talked about the how to engage your loved one in meaningful activities at the different phases or stages of dementia. So like I said, it's more topical. I'm actually trying to develop a course, and I'm using it as a way to kind of get my thoughts in line. Lori said, may you suggest a singer on YouTube? Sure. Post sing-alongs, that's great. Beth Williams is a very sweet and entertaining, and she yodels too. Yes. To this person, Miss Lucy, singing is a wonderful thing to do with people with dementia. And so here are a couple of benefits of singing, things that people don't think about a lot. When people are in the later phases of their dementia journey, they start to become more at risk for aspiration, pneumonia, etc., etc. So something that you can do with them is you want to get them to vocalize any which way you can. And so singing is a great way to do that. I will sing hymns a lot with my patients, most of the time because most people in their, first of all, because I'm a Christian, and second of all, because a lot of people grew up in church, and so hymns are very familiar in all types of songs. I sing ABCD with them. I sing Row, Row, Row Your Boat with them, Happy Birthday. Anything that'll tap into a person's long-term memory. And so songs like Amazing Grace work real well. Anything that you can get a person with dementia in their later phases of dementia, Lori, specifically for your husband, to vocalize at all, helps them with their breath support, with their ability to prevent pneumonia, and will actually help keep their swallowing muscles stronger. So definitely singing along, Miss Lucy, singing along with a person with dementia is a very valuable thing to do. So we are just about at time. Thank you so much for joining me today. Let me see if I have time for a quick last question. Does anybody else have a question for me? Does anybody else have a question for me out here, Lori? Chevy, Rock of Ages. You know, I never thought of Rock of Ages. Rock of Ages is a great one. There's a newer version of that I really love. It's in the Trinity hymnal. So Charlotte, yes, Rock of Ages is great. Anybody have any other questions before I sign off this morning? I will be back again next Saturday morning at 8 o'clock, bright and early. This is the Baffled Brain, Demystifying Dementia. I am here for you. If you're watching this on replay, please comment replay. If you're watching this live, always throw in live in the comments. It is here for you. It is for me to answer questions for you. In the comments earlier, I put down 4 ways that you could reach me. You can message me. My name is Lizette Kluta OT. You can join my Facebook group called Think Different Dementia. You can subscribe to my YouTube channel called Think Different Dementia. And there's a link to my Calendly page, which will just give you a way of actually setting up a phone call with me if you really have something that you need a little bit more personalized help with. So thank you so much for joining me. It is almost 9 o'clock, and I am super excited to have been here this morning. Like I end all of my programs, the Lord bless you and keep you. I look forward to being here again next week, and thank you for joining me this morning, and I will see you next week. Bye, guys.